Okay, good morning, everybody. Good morning. Good morning, and welcome to Philadelphia and to the Drexel University School of Public Health. I'm Ana Diaz-Roux, and I'm the dean here at the school, and I'm absolutely thrilled to welcome all of you to this symposium on reimagining health in cities, new directions in urban health research and action. And as I'm sure you all know, it's become increasingly evident that the future of humanity lies largely in cities. And as urbanization continues to increase rapidly all over the world, the majority of the world's population now lives in cities, large and small. And there are many, many good things, advantages to city living. By virtue of their density, cities can provide better access to jobs and services, including education, health, recreation, and culture. They can be hubs for opportunity, creativity, and positive social interactions across people from many different backgrounds, all of which are important not only to health, but also to the quality and the richness of our lives. As you can tell, I'm a city person, and I love cities. But city living also creates challenges for health. If not properly managed, high population density can have many adverse health effects. City living can increase exposure to health-damaging environmental factors, and the ways in which cities are designed and the ways in which resources are distributed within cities can engineer things like healthy eating and active life out of our daily lives, and can increase exposure to stressors and natural environments, which we know are important to health as well. Social conflict and violence, racism, poor work conditions can be magnified in cities with important health consequences. Cities are also marked by stark social inequalities and strong spatial segregation of people by race and ethnicity and income, resulting in profoundly different living conditions across people living often in very close proximity in the very same city. But most importantly, and I think this is key for us today, city environments are not natural. They are by definition of our own making. We can organize and build cities and their neighborhoods in ways that enhance the health benefits of cities. Through urban policies, we can affect the health of millions of people quickly and effectively. We can return to everyone the right to the city and everything that the city can give us. And this phrase, right to the city, I'm borrowing from a colleague, Ricardo Jordan from Chile, who spoke was part of a satellite meeting we had yesterday on cities in Latin America. And I love that phrase, the right to the city as an important kind of theme. So we're absolutely thrilled to welcome such a distinguished set of invited speakers. Everyone was extraordinarily generous in agreeing to come. We also have participants from many different backgrounds, from research, from academia, from policy, from foundations, from all over the world, from Europe, from Latin America, from Africa, from Asia. And we hope that this symposium will really stimulate both research and action to improve urban health, and specifically do a few things. First, challenge us to really think creatively about ways to characterize and monitor health in cities. There's nothing more powerful than a good description. Stimulate us to think about new research tools and analytical approaches to better understand the complexity of cities and the drivers of health in cities. Consider ways in which interventions, policy, advocacy, community action, civic engagement can improve the health of city dwellers. And last but not least, better understand the ways in which health in cities is intimately linked to social, economic, and political context, and the implications of this for actions, for multi-sectoral actions in urban health. So we encourage you to interact and exchange and debate and build new connections as part of the 2 days that we're going to be together. And so now, without further ado, I'm going to turn it over to Dr. Jo Ivy Buford, who will moderate our first panel. And we're not going to spend a lot of time of introductions because we have a very packed agenda and you have bios in the program. But just briefly, I'll just mention that Dr. Buford is currently president of the New York Academy of Medicine, and she has a very distinguished career in many areas of healthcare and health policy generally, and has had a number of leadership positions both in government and in academia, and has been intimately engaged in urban health issues not only in the US but also globally. So